helping patients regain independence, dignity, and the ability to return to everyday life with confidence.
Good afternoon. A very warm welcome to friends from the media. I would also like to welcome Dr. Hari Chaturvedi, Group CEO for Apollo Hospitals for Oncology. A warm welcome to Dr. Sapna Nangia, Dr. Naveen Hedle, Dr. Sandeep Dura, and Dr. Arti, and all my fellow colleagues. It's an important day today because we are launching this comprehensive clinic, and as it was pointed out, it is important. We have seen survivors in head and neck cancers, post their treatment, they have to face a lot. And what we have found out, they have a lot of difficulty in breathing, sometimes in talking. Speech also takes a problem. And that's why we at Apollo Proton Cancer Center thought we should come up with this initiative. For us, rehabilitation matters and recovery matters. For us at Apollo Proton, treatment ends, care begins. And that's the idea why we feel we should be going in for a clinic like this. CVASC brings together specialists across oncology, ENT, speech and swallow therapy so that patient gets everything under one roof. By combining advanced diagnostics, innovative treatments, dedicated rehab support, we aim to help patients reclaim essential functions. Importantly, the clinic will also serve as specialized center for professional voice care, supporting singers, dubbing artists and broadcasters. This initiative is another step in Apollo Proton Cancer Center's journey of redefining cancer care. Thank you once again to everyone who's present here for being a part of this initiative.
It's a very, very important day for us, and we actually are committed to making sure that the patients who come to us for treatment not just go back well, but they go back thriving. So they go back and do whatever they wanted to, and that is our commitment. So today I was not expected to be here, but I just landed up, so I thought that I must take this occasion moment to thank you all, that because whatever we do, unless it goes out in the public, it's communicated well and the people believe in that, the real uptake doesn't happen. So I think you play a very important role in taking this message that cancer today has come a long way. By on one side the numbers are growing, but the other side the treatments are growing better. And we have more and more varieties of treatment, and therefore the questions of better quality of life are more alive than ever before. And that is why that is at the center of all that we do. And it's a combination of teamwork, as pointed out repeatedly, that today healthcare is a team sport and oncology is the apex of that. It's the ultimate pyramid. There's nothing as more complex which requires so many people to come together and deliver to one patient at each touch point. So that is what we are committed to, and once again thank you Karan and thank you team for being here. Thank you.
Really very nice to see all of you here. You'll have to excuse me, நான் தமிழ் கற்கிறேன் ஆனால் fluency இல்லை, so இன்னைக்கு English பேசுவேன். So let me just explain that head and neck cancers are the most common cancer amongst Indian males. They require our complete attention, and focus to improve the results and improve the quality of life of patients. So not only do we want our patients to survive longer, we want them to survive longer cancer-free, and we want them to live their life, they all have a role, right? They have a role in life. That role could be of a parent, of a spouse, of somebody who is a breadwinner, somebody who is a student. So we want them to go back to their role in life. And when we want them to go back to their role in life, then all the functions, whether it is presenting themselves to society, to eating in public, each of these things is very, very important. Very often, when patients are treated for head and neck cancers, we ask them, are you able to eat at a wedding? Because that is critical. In India, a wedding means slightly spicy food, It means maybe something which may also be crisp or slightly pointy. So are you able to swallow that? Have you recovered your swallowing functions? These are all the finer details that ensure that a patient has made full recovery after treatment. So as you know, Apollo Proton Cancer Center is the first proton therapy center, not just of the country, but also of South Asia, Southeast Asia and Middle East. It has been our privilege and responsibility to bring this technology into the country and to improve the quality of life of the patients, to improve the outcomes. That is what we have seen, and that is some result we are presenting in Astro a little bit later. In September in Boston, we are presenting the results of our experience at the Apollo Proton Cancer Center of improved quality of life, better quality of life and better outcomes. We have many firsts to our credit. One of them is of course proton therapy, but we also have, there are very few dedicated cancer management teams, but at the Apollo Proton Cancer Center we have dedicated cancer management team, and today you will be meeting the head neck cancer management team. When we talk about head and neck cancer, there are other things besides proton therapy or good quality radiation, like surgery, reconstructive surgery, transoral robotic surgery, personalized systemic therapy, and all these are something that we strive to provide to our patients at the Apollo Proton Cancer Center. Now, a special mention about voice and swallowing preserving treatments. You will be hearing Ms. Aarti Soman, our swallowing and speech therapist, who will be talking about this, and then of course my colleagues in the head and neck surgical branches who will be discussing what we do here. As a radiation oncologist, I'm really happy that voice preserving treatments have been, radiation has been an integral part of voice preserving treatments. So for laryngeal cancers, for hypopharyngeal cancers, when we give radiation, and for advanced disease, when we give radiation with chemotherapy, patients are able to avoid surgery in most situations. And that is, again, a very satisfying thing as a head neck oncologist, that we are able to cure the cancer and maintain the normal pathway both for breathing as well as eating. That is, of course, one small component. There are many other components of rehabilitation and rehabilitation, and today we have gathered here to understand how these can improve the life of patients and how the CBAS clinic will be a concerted effort to do so. Thank you once again for being here.
Afternoon. Today I'll be talking about the comprehensive voice clinic, but before that I would like to give you a brief on what does a voice box do. So basically, breathing, speaking and eating are basic functions in a human. So any of these qualities, when affected, it impacts our quality of life. So in a head and neck cancer patient, about 80% of these patients have one of these functions or multiple of these functions affected at any point in their life. Voice, airway and swallowing, they all are interconnected because they are all having similar structures playing, their roles are being divided into the same structures. Now in a voice box, what does it do? So eating and we are breathing. So the main function of the voice box is preserving the airway, because when we eat, when we swallow, there are possibilities of the food particles to enter into our airway, which we generally perceive as choking. And also the secondary function being sound production or the voice. Now what are the signs or symptoms, or how does the patient come and tell us that they have difficulties? So when a voice patient comes to us, they generally have complaints of hoarseness of voice, strained voice, or weak projection in the voice, and breathiness or complete loss of voice. When an airway is having a trouble, they usually complain about shortness of breath, chronic coughing, wheezing, noisy breath or stridor, and recurring choking sensation. In case of a dysphagia or difficulty in swallowing, Generally, the complaints are pain while swallowing, food or liquid getting stuck, throat clearing frequently, coughing during meals, and nasal regurgitation. Now, what are the causes of all these problems? Majorly, the voice, airway, and swallowing complaints can arise in head and neck cancers, neurogenic disorders or tumors, structural obstruction caused by benign growths, and inflammation or reflux. In a head and neck cancer, generally these problems can be impacted upon presentation when the tumor shows itself, or as part of a surgical procedure, or while undergoing the treatment, or as part of post-treatment. So in the pictures you can see some of the tumors. These tumors can impact the closure of the voice box, impacting the voice or breathing and swallowing as such. Commonly in head and neck cancer, the tumor location is very important when we are deciding on how to intervene or how to manage the problems. So tumor location to the tongue. When the tumors are around the tongue or the back of the tongue or anywhere in the oral cavity, they have a bigger problem when it comes to the speech. Now the surgery actually impairs or changes the structure of the oral cavity or the throat. So that can also have an impact in the swallowing function. The radiation and chemotherapy, as ma'am mentioned, we are having advanced radiation and chemoradiation. So most of the patients have some amount of edema or swelling that can impact from the treatment, which can cause some amount of airway problems or swallowing dysfunction. Who is a professional voice user? So professional voice users are people who use their voice for their career. Now they are basically singers, actors, dubbing artists, news anchors, attorneys, radio jockeys or call center staff. So a voice health is basically critical for these people when it comes to their job. Now, what are the problems we see in a professional voice user? Generally, vocal abuse is the most common thing that we see there. So they would have used their voice a little too much or too louder, which would have caused this problem. Vocal nodules are small bumps. As you can see in the picture, the small bumps on vocal cords that can impact their voice. Vocal fatigue from inappropriate use of their voice, either by shouting or clearing the throat frequently, and laryngitis. Laryngitis is nothing but inflammation around the cords. Now, how do we diagnose these problems? So basically, the diagnosis comes through multiple things, but these functions are assessed using a fiber optic or flexible laryngoscopy, which involves putting a flexible camera through the nose and seeing the structures within. A video fluoroscopic swallow study, which involves a moving X-ray being taken when the patient or the person swallows something contrast-based. The third and the most important thing when it comes to a speech and swallow therapist like me is a patient-reported outcome measure or PROM. These help us in identifying not just the problem, but where exactly is the problem lying in. Basically, which aspect? Is it emotional aspect? Is it the process of eating or breathing or speaking that is the problem? Or it is more to do with the social etiquette of this patient. Treatment. Now, vocal hygiene or preserving the vocal health by using lifestyle modifications is a very, very important aspect which we generally use in Apollo Proton Cancer Center for all the patients who come to us. So the next is the therapy part. Therapy part generally involves identifying the problem and giving them small exercises with regard to voice, swallowing and airway. Medical or surgical interventions, which generally can range from as simple as a reflex medication to minimally invasive surgeries or larger surgeries. Radiation and therapy, as Nam mentioned, there will be whichever organ preserving technique that is being used for. So, in cancer center, basically many of these cancer patients, they just walk as survivors. But most of them have altered quality of life. Generally, they have difficulty either while speaking, while eating, or in general, they have a limited energy to go around with, for functions and other things. So some, they don't even know that there is something called as rehabilitation that happens after the treatment. So we at Apollo Proton, we believe that not just surviving is sufficient. We have to aim at betterment of the quality of life. So hence, we came up with the idea of a comprehensive voice, airway and swallow clinic. So we are making them choose from silence to the strength. So the aim is to improve not just cancer survival, but better quality of life. Now, this clinic offers a complete care for voice, airway and swallowing difficulties arising not just from head and neck cancers, but other neurogenic problems or a professional voice user too. Now, at Apollo Proton Cancer Center, what do we do in the clinic? The major or the most unique aspect of CVAS is rehabilitation. Rehabilitation is nothing but intervening a patient even before the treatment begins. So we can identify on what aspect is the patient lacking in. Is there some amount of anxiety? Is there some amount of social disturbances that arises because of the presence of the cancer? Or is it something to do with their voice, their speech, their airway, or swallowing? Now, we have a multidisciplinary team, as mentioned by people before me, so which provide holistic care. So, and we have a joint clinic and counseling sessions which will be provided by the clinic so that the patient is ready for the treatment even before it commences. All the treatment through the CVAS are individualized and customized for the patient. We also are inviting all the professional voice users who have difficulty for the problem. So, thank you.
டாக்டர்
வர டைமில் அவங்க கேன்சர் கண்டுபிடிச்சிருக்கிற டைம்லேயே நம்ம வந்து இன்டர்வியூ பண்ணுவாங்க. ஸோ அந்த பேஷண்ட்டுக்கு வந்து ஒரு பிரச்சனை இருக்குன்னா அது எந்த ஏரியாவில் பிரச்சனை இருக்குது, அவங்களுக்கு வந்து ஆங்ஸைட்டி மூலமாக பிரச்சனை வருதா, இல்லை ஈட்டிங்கில், இல்லைனா முழுங்குற டைமில், பேசுகிற டைமில் ஏதாவது பிரச்சனை இருக்குன்னா அது ஃபஸ்ட்லேயே கண்டுபிடிச்சோன்னா போஸ்ட் ட்ரீட்மெண்ட் வந்து அவங்களுக்கு வந்து ஈஸியாக ரிகவரி இருக்கும், காம்ப்ளிகேஷன்ஸ் ரொம்ப கம்மியாக இருக்கும். ஸோ அதுதான் நம்ம காம்ப்ரிஹென்சிவ் வாய்ஸ், ஏர்வே அண்ட் ஸ்வாலோ கிளினிக்கில் ஃபோக்கஸ் பண்ணுறோம். அதுக்கப்புறமா அவங்க ப்ரொஃபஷனல் வாய்ஸ் யூசர்ஸ் நிறைய பேர் இருக்காங்க, உங்கள் இடையிலே இருக்கும் நிறைய பேர் நியூஸ் ஆங்கர்ஸ் அண்ட் ரேடியோ ஜாக்கீஸ் அண்ட் அதர் பீப்புள். ஸோ அவங்களையும் வந்து இன் கேஸ் ஆஃப் தெர் இஸ் அ ப்ராப்ளம் வித் வாய்ஸ் அப்யூஸ், இப்போது நிறைய வாய்ஸ் யூஸ் பண்ணிட்டு கொஞ்சம் சத்தமாக பேசணும், ப்ராஜெக்ட் நல்லா பண்ணிட்டு கொஞ்ச நாள் கழிச்சு பார்த்தீங்கன்னா வாய்ஸ் வந்து ரொம்ப கம்மியாக இருக்கிற மாதிரி இருக்கும். ஸோ அவங்கள எல்லாமே வந்து நம்ம பார்த்துட்டு அவங்க எந்த விதமான தெரப்பி கொடுத்தா தான் கரெக்டாக அவங்களோட வாய்ஸ் திருப்பி வைக்கிறோம். பிகாஸ் உங்களோட வாய்ஸில் வந்து தட் இஸ் ஹவு யூ ப்ரொசீட் வித் யுவர் ப்ரொஃபஷன். ஸோ அதனால அதுக்கேற்ற மாதிரி இருக்கிற தெரப்பி கொடுத்து தான் முன்னாடி போகும். ஸோ இதுதான் நம்ம மேஜர் எய்ம் ஆஃப் வாய்ஸ், ஏர்வே அண்ட் ஸ்வாலோ கிளினிக் அட் அப்போலோ புரோட்டான் கேன்சர் சென்டர். தேங்க்யூ.
As we all know, can impact swallowing, speech and your voice. We are introducing the CVAS clinic at Apollo Proton Cancer Center. This clinic helps patients who have been diagnosed with head and neck cancer. We help them to get back to their original self at the earliest with multidisciplinary approach. Initiation of CVAS helps in early identifications and emphasis to treat these problems through a multidisciplinary approach with a very well organized protocol under one comprehensive clinic.
Today I would like to briefly tell you about the importance of launching such a specialized clinic in a hospital. We as surgeons, we see that the patients, when they come to us, they're filled with anxiety, they have a lot of questions regarding their ability to speak, ability to swallow post-surgery. So our role as surgeons is that when the patient first steps into our OPD, we try to rehabilitate the patient, by which I mean that we try to allay the fears and the anxiety of the patient, sending him to our clinic where they tell them what are the difficulties that they would expect, and it helps smoothen out their journey post-surgically.
As a speech therapist, our goal at CVAS Clinic is to preserve and regain essential functions such as speaking, swallowing, and breathing by early assessment, rehabilitation, and rehabilitation at the correct timelines to improve the functional outcomes and quality of life. Our focus extends beyond treating diseases. We help patients regain the ability to speak, swallow safely, and breathe comfortably. Preserving these functions are critical for maintaining dignity, independence, and overall well-being. Modern cancer care aims not only for survival but also for preserving quality of life. By integrating voice, airway, and swallow rehabilitation into cancer care, we can reduce long-term treatment-related morbidity and support better functional outcomes.
Hi, blessed day.
Thank you again, all the media partners, senior upper management, and my colleagues who have put up a great effort, put up a lot of effort to put this show. So I would be happy to announce the launch of CVAS clinic, that is a comprehensive voice, airway, and swallowing clinic. We all know that human beings are special because of the ability to speak and communicate, whereas in the rest of the animal kingdom, most of the animal kingdom, the purpose of voice box is to only prevent food from going into the lungs and choking. But human beings, we have developed a special skill to speak, communicate, which makes our identity and currently where we stand. So not only face is the identity of a person, voice is also identity of a person. So when a patient, when somebody loses their voice, I don't like to say patient, when somebody loses their voice, they lose their identity. So it's very important to convey that when we treat somebody who is suffering with cancer or any problems with the mouth or the voice box, can be treated with minimal effect to the voice, which can help them to overcome and get back to the normal and get their identity back. So World Voice Day is celebrated on April 16th of every year. So this year the focus is caring for our voices. So it emphasizes on daily usage of voice, which is very important for everything we need to speak. Second is professional voice users, how to look after special professional voice users, their voice, and also to develop research and propagate voice health or vocal health. This World Voice Day celebrated every 16th of April. Next is airway. Airway or breathing is means the most important thing in life. Without breathing, we don't exist. Third is swallowing. Swallowing is not just an act like some animals like snakes swallow the food, but for human beings, swallowing is not just an act. The thought of swallowing results in secretion of saliva. There are a lot of nerves involved in swallowing, a lot of muscles, up to 50 muscles are involved in swallowing. It's a coordinated effort. So whenever there is a tumor or a cancer in these areas, there will be some effect on all the three aspects, that is voice, airway, and swallowing. So that is why the concept of this CVAS came out. So when we treat as a surgeon or any of these cancers, we always whenever there is a need or requirement of surgery, we remove the part of the tumor along with some normal tissue, which may affect the ability of a person to speak, eat in public, and communicate well. So how do we minimize this
with something like minimally invasive surgery, we try to reduce the effect of this treatment so that patient can get back to their normal eating, at least whatever, not everything, but to a satisfactory level. Publicly speaking, because a lot of these patients are in the prime of their age where they're still working. So any effect on their voice, swallowing can give them social, psychological and economical distress. So we need to, whenever we see these patients, we need to make sure that we give them least mobility. So we incorporate robotic surgery, we incorporate reconstructive surgery where if we remove a part of tongue, we replace that part of the tongue with some tissue. Tongue is one of the most difficult organ God has created. We cannot recreate a tongue, but we can take some tissue and give that volume or can replace that so that patients can speak and eat as good as others. So what is the importance of this CVAS clinic is most of the centers have all these aspects what we are talking, but here we are empowering the speech and swallowing therapists to lead this CVAS clinic where because they interact more with the patients, they have the patients also tend to speak to them more and they can see them before the treatment begins, during the treatment and after the treatment, so that they know what is their journey through this treatment so they can get the best desired outcome. So we are focusing not only on cure but care beyond cure. So I would like to send a message to the public that treatment of the head and neck cancers, oral cancer is possible with minimal or acceptable problems with speaking, eating. So that because most of the people delay treatment because the fear of going over, they will remove part of my tongue, they remove my jaw, they remove my voice box. So they allow the cancer to grow and become bigger, which will make the treatment more difficult and recovery later. So we urge or we request, we want to send a message to public, whenever there is a problem, overcome that fear. It is treatable, these cancers are treatable with minimal effects if detected early and treated well with the comprehensive plan. Thank you.
You will feel bad, you will yell on me, literally, that you have made my voice very bad. First 1.5 months, I treated me with the medications. I had 2 sides polyp. One side was very little, which actually got healed by the medications itself, and the other side got resisted. Then we went through the surgery which he has done, and as he promised, in 5 weeks I recorded a song and I launched in the Spotify too, and that gave me literally not only the one thing the doctor does is that he treats it like the patient. They give motivation, they give all the thing what they can do, and the team of Dr. Naveen, Aarti ma'am, everyone superb. They always motivated me you can do it, you just go through the medication, you take the voice test and everything, but you will do that. After the surgery also you have to take the 3 weeks of voice rest. If you do it, then only I will do the surgery, otherwise I won't do. It was a very clear information which was given to me, and I followed it, and now I'm able to speak here in front of you and sharing my experience, and I'm back to my career again. One song I would like to sing. What is voice actually? Already we all know Lata Mangeshkar ji has gone. Like doctor said, voice is the one thing which comes it is an identity too. Even after before the name actually I would say, because Lata Mangeshkar ji has gone. She is not here. We remember her because of voice only. And one song she dedicated for the voice that I would like to sing for sure. नाम गुम जाएगा, चेहरा ये बदल जाएगा, ये बदल जाएगा, मेरी आवाज़ ही पहचान है, गर याद रहे. Yes, actually. Thank you so much. And this voice is regained by this team for sure. Thank you so much. Now I'm able to speak, I'm able to sing very well. Thank you so much. One more thing to be added, the voice of the doctor gives us the motivation too. Yeah.
Mr. Amal Xavier.
Thank you. Thanks for inviting me to share my experience here. My name is Amal Xavier Salagunla. I'm a Catholic priest. My journey with Apollo started in 2018 when I had a stroke. I was admitted at 1 hour of Apollo. I was treated. Then 2019 I had head injury. I was treated in Apollo Pirugudi. Dr. Anil Pandey treated me. It was fatal. By God's grace, with the doctors, with a wonderful team, I recovered and I was going on well. In 2 years before I was diagnosed with cancer vocal cord, there was voice disturbance. My archbishop said, there's something wrong with your voice, go and check. So I went almost 10 ENT doctors. Invariably, every doctor said, there is a growth we have to do by surgery, remove the growth, then we have to send it for biopsy. When they said biopsy, it means there is a doubt cancer. So I went back to Dr. Anil Pandey and said, this is the situation, what shall I do? Then he referred me to Dr. Naveen. So I went to Dr. Naveen, he checked, he said, we'll do biopsy first. All others doctors said, we'll do the surgery. Now reversing, first biopsy. Dr. Naveen did biopsy, then diagnosed the second stage of cancer. Then radiation started with the Dr. Sobranaika. Wonderful journey, and there was no doubt about the treatment or the approach, the doctors, or the way they were explaining to me. There was no fear for me because the presentation was so well and I had no fear. Every day when I went for treatment, radiation, I used to go to the inside the radiation room, and with smiling face I was coming. Every time when they come for a review, Dr. Arati used to remind me, you're going to get back your voice back. She's a singer, I was a preacher. So, what I'm trying to tell you is that doctors are treating, God is healing, and when you believe, miracles happen. I strongly believe in that, and when you believe, everything comes together, then we come back to normal. Dr. David was telling back now here at the stage to give back what they've lost, especially voice. And for me, for a singer, voice is important. For a preacher, voice is important. Now, almost after radiation, completion of radiation, only 6 months I took rest. I went back to teaching. I was taking classes to the seminarians. Then, now I am placed in Adaya St. Louis Church near Michael's Academy, full-fledged, full-time parish priest. I'm happy and grateful and gracefully acknowledge the team that I had, Dr. Swapna and Dr. Naveen, Arati. Thank you so much. I'm grateful and very grateful to all of you.
Little bit Nangya and Dr. Naveen had need to share few thoughts about their treatment from your perspective too.
As I told you, treatment is not me alone. Before I subjected for laser excision, 1.5 months I said to Aarti before I was forced to operate because she had to perform some coming up. So as I told you, it is not me or one person, set of doctors, and not only doctors, there will be people behind the scene, clinic run by nurses the physiotherapists, the pulmonologists. So that's the importance of Siva's clinic. It is not all of us working together can.
Naveen has said. So as he mentioned, there are 50 muscles that are used when we are swallowing. There is patients who receive treatment not just for the voice box, but tongue, tonsil, base tongue. They can have swallowing difficulties. Patients who have disease involving the vocal cord and the voice box, they can have speaking difficulties. And sometimes if any of the tumors in this area is too large, there can be a breathing difficulty. And together, and when I say together, I don't mean only the doctors, but together with the patient and their families, we have to chart out a path. The prehabilitation and rehabilitation involves the patient's efforts just as much. The patient's positive attitude, the patient's compliance to the treatment, and of course, I did not have to treat Rinku because she didn't have cancer. She had a polyp, which is a non-cancerous condition. That typically happens, as Aarti mentioned, in people who use their voice. But Father Xavier, of course, did have a malignancy, and again, it was his faith, his positive attitude, along with the treatment. So I must mention here that you are seeing some people sitting here, but there's a whole big team at the Proton Center, our physicists, nurses, therapists, and together this large team is required for us to be able to deliver what is essentially these days a very refined form of treatment.
Check biopsy and everything panna as now the singer clearly 1.5 months at least medications voice test full and the polyp dilute clear we don't want to like surgery but on two sides vocal polyps two sides vocal cords vocal folds but one side medications clear but second side agala and November commitments because I am a traditional singer. From November I had already commitments I book bookings so idu cure because cancellation is very big issues. Around 15 to 20 events was there lined up. அதனால சார் கிட்ட சொன்னதும் எஸ் அது ஆகல இந்த பார்வை பார்க்க பகலிரவா பூத்திருந்தேன் மனமாலை ஒன்று பூவாய் கோத்திருந்தேன் அந்த செய்திக்காக நொடி நொடியா வீத்திருந்தேன் சூரியன சுருக்க பயில் நான் அள்ளி வர ஆசைப்பட்டேன் சிங்கத்தையும் சில நாளா இந்த சின்ன சின்ன கண்மலுக்குள் பூட்டிக்கிட்டேன் தண்ணிக்குள்ள தான் நட்ட தாமரை கொடி தேப்ப குளத்தைய குடிச்சிருச்சே ஒரு வார்த்தை சொல்ல ஒரு வருஷம் காத்திருந்தேன் இந்த பார்வை பார்க்க பகலிரவா பூத்திருந்தேன்.
For our patients, the reason is because we hope to help our patients lead a more, I would say, inclusive life with the society, help them mix well, help them have good quality of life, and so that they can maintain a proper social appearance. I would like to promote that this clinic will definitely help these patients do well in their life. Thank you.
the launch of Apollo Proton Comprehensive Voice Airway Swallowing Clinic, what I would like to emphasize is this is when reach out to us, and this clinic will be led by our voice and speech and swallowing therapist Aarti, who will help come to a conclusion regarding what are the problems in day-to-day life we face with problems of voice and swallowing. And also as we are a cancer center, we are emphasizing on head and neck cancers, where treatment begins before the actual treatment starts. So we make sure that eating and speaking before the treatment, during the treatment, after treatment are monitored, and whatever best to bring the best out of the patient for their best outcome, and they get back to their normal life, near normal life as soon as possible. And also to the professional voice users, we are happy to provide our services, so that, as it always tell, going to gym and lifting weights without a monitoring or without a coach can result in bad strain or stress. Similarly, if you use your voice in a bad way without a coach or a trainer, it can, especially even if you are a professional voice user, can result in bad voice, which can hamper your performance and your future.
Okay. நான் இதுதான் சொல்ல விரும்புகிறேன். ஒரு ப்ரொஃபஷனல் சிங்கராக இருந்தேன். பட் எனக்கு ப்ராப்ளம் வந்ததுக்கப்புறம் நான் வந்து ட்ரீட்மெண்ட்காக இங்கே வரதில்லை. பட் ஆஃப்டர் ட்ரீட்மெண்ட் இப்போ நான் வெறும் கிளியர் வாய்ஸாகவே இருக்கேன் எனக்கு இப்போ. அண்ட் நான் இப்போ திருப்பி சிங்கிங் ப்ரொஃபஷனலையும் திருப்பி போயிட்டு தான் இருக்கேன். அண்ட் நான் இப்போ வந்து ரொம்ப நல்லா எனக்கு வந்து வாய்ஸ் கிளாரிட்டியும் இருக்குது, எல்லாமே இருக்குது. ஸோ கேன்சருக்கு மட்டும் இல்லாமல் பேசிக் நம்ம எந்த ப்ரொஃபஷனலாக இருந்தாலும் நம்மளுக்கு வாய்ஸ் ரொம்ப இம்பார்ட்டண்ட். அதில் டீச்சராக இருந்தாலும் சரி, நம்ம நியூஸ் ரீடராக இருந்தாலும் சரி, ஆங்கர்ஸாக இருந்தாலும் சரி, அண்ட் நான் சிங்கராக இருந்தாலும் சரி, நம்மளுக்கு வாய்ஸ் ரொம்ப இம்பார்ட்டண்ட். ஸோ எனி சேஞ்சஸ் நம்ம வாய்ஸில் வந்ததுன்னா கண்டிப்பாக ஒரு வாட்டி வந்து செக் பண்ணிவிட்டு என்ன ப்ராப்ளம் பேசிக்ஸ்லேருந்து நம்ம செக் பண்ணிட்டோம்னா ஸ்டார்டிங்கில் நம்ம வந்து கிளியர் பண்ணிக்கலாம். ஸோ எனக்கும் அதே மாதிரி கிளியர் ஆச்சு. அண்ட் நவ் ஐ எம் ஹாப்பி ஃபார் ஷுர்.
டாக்டர், கேன்சர்ல வந்து எந்தெந்த கேன்சர் ட்ரீட்மெண்ட் பண்ண முடியும்? ஸ்டேஜ் வைஸ் ட்ரீட்மெண்ட், கீமோதெரபி, வேற என்ன ட்ரீட்மெண்ட்
கேன்சர்? என்ன கேன்சர், என்ன சைட், அது வாயில கேன்சர் இருக்கா, தொண்டையில் கேன்சர் இருக்கா, அது சைட் மேலே டிபெண்ட் ஆகும் என்ன ட்ரீட்மெண்ட் பண்ணணும். இங்கே தொண்டையில் கேன்சர் இருக்குன்னா மெயின்லி ஸ்டேஜ் 1 to stage 3 இருக்கு, சர்ஜரி பண்ணலாம். அதுக்கு ஃபர்ஸ்ட் பயாப்சி பண்ணிட்டு டியூமர் போர்டு எல்லாம் மீட்டிங்கில் டிஸ்கஸ் பண்ணி, மேடம் சப்னா மேடம் இருக்கு, அவர் ரேடியேஷன், அது நான் சர்ஜிக்கல் ட்ரீட்மெண்ட், அது வாய்ஸ் பாக்ஸ் ரிமூவ் பண்ண அவசியம் இல்லை. வித்தவுட் தட், ஸோ பேஷண்ட் கேன் ஸ்பீக், கேன் பி. அதர்வைஸ் ரிமூவிங் வாய்ஸ் பாக்ஸ், இங்கே பர்மனெண்ட் ஓட்ட வரும், இங்கே ப்ரீத் பண்ணணும். இது ஆர்கன் ப்ரிசர்வேஷன் ட்ரீட்மெண்ட்ல அது தேவையில்லை. வித்தவுட் சர்ஜரி, with radiation and chemotherapy, depending on the stage, we can treat this cancer. அதே மாதிரி மவுத்ல கேன்சர் இருக்கு, அதுக்கு ஃபர்ஸ்ட் சர்ஜரி பண்ணிட்டு டியூமர் எடுத்துட்டு, அதுக்கு நெக்ஸ்ட் ஸ்டேஜ் டிபெண்டிங் ஆன் த ஸ்டேஜ், அதுக்கு அட்ஜுவன்ட் ட்ரீட்மெண்ட் தேவையோ அதுக்கு ரேடியேஷன் இல்லை கீமோதெரப்பி ஆட் பண்ணிட்டு பெஸ்ட் ரிசல்ட்ஸ் அவுட்கம்ஸ் வரும். அதே டைம்ல பிளாஸ்டிக் சர்ஜரி பண்ணிட்டு டங் ரிமூவ் பண்ண, அது டங் ரீகன்ஸ்ட்ரக்ட் பண்ணிட்டு வாப்ப திருப்பி பேச முடியும், சாப்பிட்டுக்கு இது யூஸ் ஆகும்.
கேன்சர்ல டாக்டர், பிரஸ்ட் கேன்சர், பிரெயின் கேன்சர், நிறைய கேன்சர் இருக்கு. இந்த எந்த கேன்சர் வந்தா உயிர் காப்பாற்ற முடியாது?
இப்போ என்ன கேன்சருக்கு அது இல்லை, எல்லா கேன்சருக்கும் இப்போ ட்ரீட்மெண்ட் இருக்கு, வேற வேற ட்ரீட்மெண்ட் இருக்கு. இப்போ நிறைய நியூ ட்ரீட்மெண்ட்ஸ் வந்துட்டு இருக்கு. அது பிரெயின் கேன்சருக்கு ட்ரீட்மெண்ட் இருக்கு. அதுக்கு என்ன ஸ்டேஜ்ல இருக்கு அது பார்த்துட்டு, அது ஸ்ப்ரெட் ஆகிட்டு இருக்கா இல்லை லோக்கலைஸ்ட் இருக்கா, டிபெண்டிங் ஆன் தட் வேற வேற ட்ரீட்மெண்ட் இருக்கு. இப்போ நிறைய ட்ரீட்மெண்ட் கீமோதெரப்பி, ரேடியோதெரப்பி, பாலியேட்டிவ் ரேடியோதெரப்பி, இல்லை சர்ஜரி பண்ண முடியாத கேன்சர் இருக்குது, நிறைய பெருசாக கட்டி இருக்குது, அதுக்கு புரோட்டான் தெரப்பி, நிறைய ட்ரீட்மெண்ட் பண்ணிட்டு இப்போ என்ன கேன்சர் இருக்குது அதுக்கு ட்ரீட்மெண்ட் இருக்குது. க்யூர் ரேட்ஸ் டிஃபர் ஆகும், பட் ட்ரீட்மெண்ட் தான் இருக்குது.
பிளட் கேன்சர் வந்து ரொம்ப ரிஸ்க்ன்றாங்க, அது எந்த அளவுக்கு உண்மையா? பிளட் கேன்சர் ரொம்ப ரிஸ்க்ன்றாங்க, உண்மையா?
பிளட் கேன்சருக்கு இப்போ ட்ரீட்மெண்ட் இருக்கு, போன் கீமோதெரப்பி இருக்கு. நான் ஸ்பெஷலிஸ்ட், பிளட் கேன்சருக்கு ஸ்பெஷலிஸ்டா இல்லை, பட் பிளட் கேன்சருக்கு ட்ரீட்மெண்ட் இருக்கு, கீமோதெரப்பி இருக்கு, போன் மேரோ டிரான்ஸ்பிளான்ட் இருக்கு, நிறைய ட்ரீட்மெண்ட் இப்போ இருக்கு.
So what I would like to say is that firstly we must understand that head and neck cancers are very important for India. They are the most common cancer for Indian men, and a lot of work is being done in India to make the outcomes better. Lot of studies are coming which are making the outcomes better. At the Apollo Proton Cancer Center also, we are very committed to doing our bit to see how technology can make the outcome of treatment better. So we are the pioneers of using proton therapy for treating oral cancers. As you know, we were the first proton therapy center of the country. We are the first proton therapy center of the country. Now we have more than 7 years experience, and now we have treated more than 2,500 patients in total with proton therapy, and a big chunk of them is head and neck cancers. When we use proton therapy for head and neck cancers, we have noted that in certain areas, especially oral cavity, tonsil, base tongue, the outcomes are better than using normal radiation, and also the quality of life of the people is better. Their weight loss is less. Elderly patients, they require less strong painkillers. They are able to take the right kind of systemic therapy. Like otherwise, older people, we can't give them chemotherapy along with radiation because they are frail people. But with proton therapy, we are able to give chemotherapy in spite of the fact that we are giving them radiation and the patients are frail. And besides that, there is a lot of emphasis on improving the quality of life of the patient by preserving their functions, whether it is reducing their taste problems, whether it is reducing their dryness of the mouth problems, and the emphasis of this clinic by reducing problems associated with voice, with breathing, and with swallowing.
Thank you.